Um, Good evening again, everybody. Let me stop sharing my screen so we can see our candidate. Good evening again, everybody. We are here going into Senate District 32. We've got Senator Paul Rose joining us. Good evening, Senator Rose.
Good evening to you, Clint, and to the rest of you.
All right. Thank you for joining us this evening. We're going to get right to it, Senator Rose. We've got 3 questions for you. Before we do that, I want to point out again that we're joined tonight by our Legislative Chairman, Dr. George Woodbury. Thanks for joining us, Dr. Woodbury. Senator Rose, we're going to go ahead and start with our questions.
Okay.
Governor Lee recently issued Executive Order 15. Amongst the provisions in that order include the ability for nurse practitioners to practice with autonomy. What's your position on the expansion of scope of practice for non-physician providers like nurse practitioners and physician assistants?
Man, it's been a process for me. I've shared with Dr. Woodbury at a society meeting, I think maybe a year or so ago, and then when he was in my office, I get all of my healthcare provided by a nurse practitioner, and of course she works under the supervision of Dr. Craig, and I've been very pleased with the service they've provided. But I absolutely want to share with you. Let me see if I can silence what's going on my. Are y'all hearing that dinging? Anyway, I'm a general contractor, and I've got 45 years of experience, and I can build a lot of things. But I'm not an engineer, and I'm not an architect. So when we get ready to build anything of significance, or really just about anything, go to the professionals, the people who've got the education, the training, and I depend on them to put their name on the dotted line to say this is how it's got to be built, and my job is to build it. And as much as I appreciate nurse practitioners, and there's a whole lot more of them than there are doctors, but I'm sharing my true beliefs. I really think your position is the right one. Now, in a pandemic, had this thing really gotten to where some were predicting where there were going to be, 3 million deaths or whatever, yes, absolutely. I think in an emergency situation, the governor should be allowed to do whatever he could to help save lives. It never got to that point, at least in my opinion. It hasn't. I don't think it will. So, I hope my explanation clarifies the analogy with engineers and architects and contractors versus. So that's where I stand. I've read your policies and your position, and I agree. I think I'd love some more information another day, maybe on the buprenorphine. I know that's one issue that I've heard them talk about because of the prevalence of overdosing and whatever, that they would have them in a life and death situation. So I think there may be some give and take there that just in that area. So that's where I am.
Okay, thank you. We're going to move right into the next question. So I know you said you work in construction, so you may be looking at this with multiple hats, but people are having to make a lot of difficult decisions when it comes to balancing their personal physical health, or maybe the health of their community, with economic health and that desire to get back to business. We hear that phrase a lot, let's get the state or the city or wherever back to business. Can you talk about your thought process when you get faced with that type of challenge?
Well, of course, we were faced with it, and our company was considered an essential business because of what we do. Whether you agree with that or not, that's the directive that was given by the governor. So we had to put in place guidelines to make sure we took care of our employees, our clients, our customers, and the general public. And I've got in my hand a 29 items that we adopted. Some issued by the CDC, some we incorporated some of the companies we work for, what they required, and then some things we put in place. I'll tell you, I think it's very important as we go forward that we're real careful about shutting our economy totally down. it's my opinion that we could do more harm than good by doing that. And I appreciate doctors, but if you listen to the news, whichever you listen to, you're getting opinions all over the place on what we should do, what we should have done, what we should do going forward. I think for me as a legislator and also as a businessman, I would look at some common sense things that we could do, make sure we protect our most vulnerable population, which seems to be those people that are my age and older that have, compromised immune systems. And I have some belief in this herd immunity. So I'm talking to doctors, and you guys may tell me, look, you need to go back to building buildings. But so anyway, that's just some thoughts. I think we've done a lot of harm by shutting down businesses that maybe could have remained open with some more. I mean, again, if you go to Walmart, the Kroger, you go to Home Depot, Lowe's, people were in there in masses. And I couldn't understand. It seemed like almost like we picked and choose. Again, we were open. Now, a lot of our customers shut us down and wouldn't let us get into their places. But I think looking back and then looking forward, maybe we can do a better job of how we go about shutting down businesses. So hope that answers the question without going around the tree too much.
Well, no, that's perfect. Thank you. So kind of staying on the economic front, it's inevitable as, the pandemic continues to put constraints on our economy that revenue is going to experience a shortfall, and we're going to have to make some difficult decisions, likely with next year's budget. So can you talk about when it's time to make cuts, how you prioritize that, and would you cut healthcare anywhere if so?
Well, if you don't mind, I think I can go through it pretty quick. I'd really like to share some of the things that we did during our last legislative session, and most of these had to do with COVID-19. So I'm just going to go through these, and I can provide you this document. But and again, when you're talking about adding $9.2 million in recurring funds for adult healthcare safety net and $3 million in recurring funds, that's not a lot of money. It doesn't go very far. I understand that, but what we did, we added $26.5 million to strengthen the safety net for both mental health and healthcare services, $19 million to support the healthcare network, $7.3 million to support the children's behavioral and mental health services, and $3 million to expand the school-based behavioral liaison across the state. You want me to stop this, but I'll go on through these. Fully fund inflationary growth in TennCare, additional $1 million invested in rural hospital transformation program so they can continue to evaluate their business models and efforts to ensure effectively operation and address healthcare needs that arise under these extraordinary circumstances. In addition, we provided $150 to establish a new fund to cover public health and safety issues related to COVID-19. Includes $10 million in small and rural hospital readiness grants. We also, legislation that helps rural health clinics recruit doctors. We voted to continue funds to support hospitals, nursing homes, and ambulance services. And on the ambulance services, I didn't agree with the amount we approved, but we carried the amount up to enough that the ambulance services can get full funding from the federal government. Now, with all that said, our healthcare system is still woefully underfunded. A lot of discussion on taking the TennCare dollars, but the decision was made before I got there, and I actually do support that decision. The federal government would love for us to buy into the Obamacare, TennCare policies, but then 3 years from now, it's all on us to fund it. I don't think we figured out how we could do that. So I wish I had all the answers for that, but we are doing some things, and it is a strong focus. Got 3 doctors in our in our Senate. I sit right next to Dr. Briggs, talked to him earlier today, and he'll be in Memphis, Nashville tomorrow, but some great men in there with some great minds, Dr. Hensley, and then Dr. Dickerson. So got a couple of nurses in there. So I think we're well, and 3 pharmacists in there. So we're well represented in the medical field. So they're looking out for you, I think, and for the folks that need the health care.
Well, good. It's definitely a complex issue, and we don't expect easy answers. So that's all of our prepared questions. We wanted to leave you some time at the end. If you want to expand on healthcare at all, you're welcome to. If you want to talk about other issues or just speak in general, the floor is yours.
Thank you so much. And again, I appreciate the opportunity to share. And I'm not sure who all's on there. I see a photo of Allison Cook, but I think there are probably a few more on there. But I'm going to ask, are all of you doctors that I'm talking to, is that correct?
Mm-hmm.
Well, good. Well, thank you for what you do. I appreciate the care you provided to me and my family through the years. A couple of things that we did not get done in the last legislative session that I believe will be back in session August 10th. One is COVID liability, which I think is very critical, so that whether it's businesses or doctors or schools, churches or whatever that are allowing people to come back to some sort of normalcy have got some extended protection. As we all know, there's plenty of lawyers out there that are willing to sue anyone for anything that they can. And you guys are probably at the top of the list when it comes to that. So I think it's important. The governor thought it was. And the biggest thing there is whether or not it's retroactive. The Senate lawyers thought that because of extenuating circumstances, the court would uphold retroactivity. The House did not think so. So they were at an impasse, and it was 2 o'clock in the morning, and I think tempers get out of control. I was not in there when that was going on. Telehealth, another one that couldn't come to agreement on, where let me back up and say we need broadband service all across Tennessee, because telehealth is no good if you don't have broadband access. So working toward getting that done. So let's assume we've got broadband access. To be able to call your doctor and discuss what's going on, I think is good use of the patient's time and the doctor's. The question is, how are you paid? And there's a question on total parity from now on, a parity for 3 years, parity for 5 years. And that's where the discussion, and so your input to me and to other legislators is going to be critical. We will be discussing that August 10th, so I'd love to hear from you what your thoughts are on that. And then another thing that I think's so important in our society today, and I'll get on my soapbox a little bit. We have a group of people that will take our nation. We see the anarchist, the disrespect for law and order. I'm just sickened by what I'm seeing, and I'm thankful for a governor and a legislature, for the most part, that will not tolerate that. We saw it on the attacks on Nashville when we were there this last session. Of course, you see what's happening in other places in Seattle and Los Angeles, and it's so unfortunate. So those things are real near to me. I think about my grandchildren. I can ride this out, whatever it ends up being, but I think about my grandchildren, what it's going to look like for them. So standing up for our law enforcement, our military. I don't agree with everything that Donald Trump has done. I don't like the way he says it very often, but he's gotten a lot of really good things done. So you need to know as a group that I am a Trump supporter. I'm not a Trump supporter to everything he said, but I like what he's getting done in his platform. So with that, I don't think I have anything else. I will tell you this finally, but a little bit about me. I am a Christian. I'm a conservative. I am a Republican. And I try to make all decisions I make based on my genuine faith in the Almighty God. And I tell others, and it's not new with me, but I stand for the flag and I kneel at the cross. So that's a little bit about who I am. You in any way I can. Thank you for your time.
Thank you, Paul, and good luck to you on the campaign trail. That actually concludes all of our interviews for the evening. I hope you'll join us Thursday for our next candidate session, which will begin at 5:30. We'll run down a couple more of the districts that have competitive primaries. Thank you, Dr. Woodbury, for joining us. Thank you, Senator Rose, and all of our candidates tonight. And thank you, Allison Cook, for being our producer behind the scenes. Everybody have a good night. Thank you.
Thanks so much.